Well, more words and line items in Washington as Congress kicks off the week continuing to debate on the budget reconciliation bill. Already passed the U.S. House, now the Senate has that final consideration. An argument over semantics in the section focused on Medicaid, though. Republicans say it's designed to prevent fraud and abuse of the health care program, while Democrats say it's a dangerous cut that will cost lives. You can see how widespread that chasm is, right? Perspectives are one thing, but data, that carries a little more weight. So there's new data out today from the American Cancer Society, the Cancer Action Network, numbers on how many Idahoans are expected to be impacted if this bill passes as is, Joe.
And Medicaid advocates say that this is the time to be talking about the data that has taken some time to put together. And let's dive into it, Brian. This is new data that is from Manat Health Research, and it just finished up June 2025. They project that more than 40,000 Idahoans could lose coverage if the bill passes as is. There is a chance it could get amended, but as is, about 75% of those 40,000 are part of the Medicaid expansion population. And the state of Idaho expanded Medicaid in 2020 after voters approved it through a ballot initiative. As of October 2024, there were 314,000 and some change enrolled in Medicaid and the Children's Health Insurance Plan. So about 13% of all those on Medicaid here in Idaho could lose coverage. But it's not like people are randomly going to get a letter in the mail and just say, sorry, you were the people that were cut. Cuts come in 4 different categories. So there's a work requirement, which we have talked about. The bill would require many Medicaid recipients to report work or community engagement activities. If people can't or don't complete these requirements, they could lose their Medicaid coverage. There's also more frequent checks. The states would have to check eligibility, whether people are still qualified on the program, every 6 months instead of once a year. This more frequent process could lead to more people losing coverage due to paperwork and cost sharing. The bill would require some people to pay more out of pocket for certain services, and if they can't pay, providers could deny them care. And there's also a limit on state funds. The legislation would block states like Idaho from raising certain taxes used to fund Medicaid, making it harder for states to pay for the program and potentially leading to benefit cuts, forcing the states to make choices on how can we afford this program. So the cuts, some argue, are a result of making it harder for people to stay enrolled and by reducing the amount of money available for the program, resulting in savings on the program. Erin Riley from Idaho Protects Medicaid details the impact of it.
People aren't going to be able to work. People are going to have to decide whether or not they're going to pay their bills, choose food on the table, or whether or not they're going to go and get maybe a screening or health care until it's a real major emergency.
So those 4 areas, I want to dive in on one more as an example. The cost-sharing provision is certainly one that medical advocates are drawing attention to. For certain Medicaid expansion enrollees that are above the poverty line, the proposal outlines that states like Idaho, they must start charging some co-payments for some services that right now don't have them, but with strict limits and protection for essential care. So the intent here is to save federal funds, but it may also limit access to care for some. There is a safety net. The cost sharing cannot be imposed on emergency services, primary care, mental health, or substance use disorder. House and Senate Republicans estimate that the cost sharing would save $18 billion over 10 years. But advocates against the bill say that there's a human cost.
These aren't numbers on spreadsheets. These are our neighbors, our family members, our friends that are going to be losing access to health care. You know, if you care about protecting healthcare in Idaho, if you care about making sure that people get that access and stay healthy, then, you know, it's time to speak up about this.
So the breakdown of about those 40,000 we talked about that are projected to lose care. Let's take a look at the breakdown. 31,237 Medicaid expansion adults. So these are working age adults earning up to 138% of the federal poverty level, a little more than $20,000 for an individual in 2025. They gained their coverage through expansion. About 2,700 children and families may struggle to navigate some of the increased bureaucratic requirements, according to advocates. They call this red tape, some of these new requirements. Same goes for 734 people with disabilities amongst the medically vulnerable populations and 513 seniors, often on fixed income. So, Brian, that's the number here in Idaho, a little more than 40,000. Advocates also say that about 9 million people across the country could lose coverage because of things like extra steps, For example, again, this isn't a situation like we heard in the state of Idaho where people are just getting a letter in the mail saying, sorry, you're out of luck. But there are more, I guess, ropes or sideboards on the program that Republicans are saying if you're really a part of this program, you will do the paperwork. Against that, though, people say that sometimes it's hard paperwork to get done.
I think a lot of people look at that 2,700 when it comes to children who really don't have any advocacy in this or ability to, I guess, follow those sideboards.
Yeah, they have to depend on a guardian making sure the paperwork's in.
All right, thank you, Joe.